Our guest today is a cancer specialist who has been in the field since 14 years, closely studying and contributing to advancements in the treatment of the disease. Please welcome Ms. Sweta, a board certified medical oncologist and hematologist for Florida Cancer Specialists and Research Institute. Hi, Sweta. Thank you for joining us today.
Thank you for having me.
So, cancer, it surely has become one of the most challenging diseases of our time. In fact, the word alone, it carries a lot of weight. And for most of us, it is surrounded by uncertainty and fear. So, can you just break these web of words and explain cancer in simple terms?
So, cancer is basically a disease where our body cells grow uncontrollably and can then form a mass or a lump. And then they, in addition, have the ability to then spread to other parts of the body. So, normally we have like a break system. So we have a cell cycle that our cells grow and they divide and they die, and it's a good checks and balance. But if that fails for whatever reason, the cells will start growing uncontrollably, and then they can start invading and going to other parts of the body, and that's what we call malignancy or cancer. There are some people who have benign tumors, which means they're growth, but they don't have the potential to travel elsewhere. So, in simple terms, when we talk about cancer, it's the malignant ones that we are concerned about, are the ones that can have the potential to travel to other places and invade surrounding areas.
What are the causes of cancer? I mean, can it happen to anyone?
So theoretically, cancer can happen to anyone. And the way I like to look at it is that we all have external as well as internal influences that can both play a role and can cause cancer. So when we talk about external influences, that can mean, environmental exposures, lifestyle choices, exposure to certain infections. These are some of the, risk factors. And intrinsic influences are, genetic predisposition. So something going on in your body that can cause cancer. So there's always this debate, how much of the extrinsic and intrinsic influences come together to form cancer. And that's an ongoing topic of debate that there's extensive studies that are ongoing. So for example, we know that smoking can cause lung cancer, but only a small minority of patients that smoke develop lung cancer. So that's where the genetic predisposition comes into play. So something about the internal, environment of the body has to combine with the carcinogen risk of smoking, and together this predisposes the body to form cancer. So yes, theoretically, it can happen to everyone.
And what are the early signs of cancer?
So the things I like to kind of discuss, which are, early signs, is anyone having unexplained weight loss. So for example, I usually like to quantify that as 10 pounds or more, or 10 in kilograms, I'm sorry. Probably I would say at least 5 kilograms, kgs or more. So if you're unintentionally losing weight without trying, and you sort of keep on losing weight within a 6-month period, although there may be other causes, it is something to see your doctor about. Okay, the next one is, I would say, fatigue. So, we all are tired, we work, if people have kids to take care of. But if you are starting to have a new pattern where you're feeling very tired, out of proportion, you're even the smallest activity is causing you a lot of, shortness of breath, or like very excessively sleepy, that's another, warning sign to at least get evaluated. The next big thing is probably, I would say, pain. So any new onset of pain. So let's say you've never had heartburn or you never had indigestion, and all of a sudden you start developing a lot of pain in the mid abdomen after eating, or back pain that's, lasting more than a week and it's just ongoing. Same with headache. So any new pain that's lasting more than a week that keeps coming, it's recurrent, it's getting worse. Those are all, signs to look forward to. Another, go
Yeah.
ahead.
Yeah,
Go
please
ahead.
go ahead.
Another sign, which, can be for many other reasons, is fever. So what I mean by, especially, there's a lot of infectious causes of fever. But in typically for cancer related fevers, what we see are they happen at night, they're night sweats. People usually tell me my pillows are drenched in sweat. So those are kind of, and common causes of India for night sweats are also tuberculosis. So we always have to kind of rule those processes out. But any new onset fevers that are recurrent, that are ongoing, occurring at night, is an important sign. And I think another big one is our largest organ of our bodies, our skin. And I feel like the skin is a good reflection of what's happening inside of your body. So,
Yeah.
for example, if you look pale, that may be a sign you're anemic. Same thing
Mhm.
with jaundice. If somebody looks yellow and their eyes look yellow, that can be an indication of something going on in your gallbladder, or there's a blockage in your gallbladder, or some kind of issue going on in your pancreas. So always paying attention to new rashes or any changes in your skin is also a warning sign. So I mean, these are kind of the more generalized top, symptoms that I tell patients to look for. So any pain, new fevers, weight loss, fatigue, and any skin changes.
And so these symptoms, they are personal to everyone, as in it changes from individual to individual. It just depends on their, how their tendency or their, their body type.
Correct. So, keep in mind, just because you're having these symptoms, there's always many other causes for having these symptoms. So it's not to scare people into thinking they have cancer, but it's important to, if you have ongoing pain or ongoing fevers that are unexplained, or you're losing weight, you always have to get evaluated, and because cancer may be a causative factor.
And what qualifies as the major causes of cancer?
So, major causes, just to give an outline, are, number one, I would say is probably cigarette smoking, um, and it's associated with almost 13 different types of cancers. So, I mean, pretty much all your major cancers, the risk factor is cigarette smoking. And it's also the longevity of how long you smoke. So, the longer you smoke, the more there's risk factors. And the unique thing about tobacco smoking is it's a direct cancer causing molecule. It acts in so many ways to cause cancer. It causes irritation, it causes inflammation, it interferes with the immune system. And in addition, the particles can cause cancer. So that's a major risk factor. And that can occur with pipes, that can occur with vaping, it can occur with secondhand smoking. So even that secondhand exposure puts you at risk. So that's pretty much, like I said, 13 different causes, and it's probably one of the most preventable cause of cancer. The next is probably, if you are exposed to radiation as a child, for, sometimes people get early childhood cancers that can predispose you to adult onset other kind of cancers. That's not a common risk factor, but, any kind of exposure to radiation. And that includes UV light. It's more for, fair skinned individuals, but still we are at risk if you are constantly getting exposed to, radiation from the sun. That does predispose you to skin cancers. So that's one thing to keep in mind. Air pollution. So, any diesel exhaust or particle air pollution, that has been shown to be a risk factor for lung cancer. Radon, arsenic. Again, these are environmental causes. You should always check your water to make sure it's not contaminated with arsenic. Um, so these are kind of individualized based on where you're living, and probably not for in a city, but in a rural population, kind of knowing what you're environmentally exposed to is important. The other big thing is infections. So most people don't know that certain type of infections can predispose you to cancer later on in life. One is called a human papilloma virus. Okay.
Okay.
And that people can get that virus as a young adult or a child, and it can later on cause cancer of the cervix, the head and neck, the oropharynx. So sort of the top and the bottom, we would say. And it's really important for patients to know that these are conditions we get screened for, and you can get treated for early on, and you can even get a vaccine for HPV to prevent cervical cancer later on. Other things are like hepatitis. Hepatitis B and C can cause liver cancer. So again, if someone has hepatitis B and C, it's important they get treated, because if they don't and they're untreated, they can later develop liver cancer. They can
Okay.
also develop cirrhosis. Um, there's a bacteria called H. pylori, which can cause stomach cancer. So kind of having the knowledge that certain infections can do that and having right screening becomes important. The other big one is alcohol. So alcohol, again, can put you at risk for liver cancer, colon cancer, head and neck cancer, and it works synergistically with alcohol. I mean, with smoking. So if you smoke and drink, you're kind of increasing your risk. Other things I would say is probably obesity. So this is a newer sort of world problem, is higher body fat, and just being obese in itself can again predispose you to as many cancers as almost smoking. So it's a major big risk factor, and it's part of some of the things we can do to prevent cancer is to lose weight. And certainly, if you're in certain occupations and you're exposed to certain chemicals, that
Okay.
over time that puts you at risk. So these are some of the common risk factors.
Given our demanding lifestyles, I think stress and anxiety, they have become, a very common part of our lives. Do you think stress is a major cause of cancer?
I don't, there's always, a lot of studies of sort of correlative risk, which means that, there's no direct studies saying that stress causes cancer, but one can assume, we all are born with what we call flight and, fight response. So when we see danger, we have, our metabolic, our cortisol, our stress hormones get activated, and our body kind of swings into action to get away from danger. That's kind of like an innate, tendency that we all have. But what happens is if someone has that chronically activated, so if someone's always under chronic stress from their job or for whatever, family disruptions, whatever that may be going on, they always tend to have that cortisol and the stress hormones, and they're always activated. And that we know can lower your immune system, that can make you prone to illnesses and more prone to sicknesses in general. So we can correlate that probably that can indirectly lead to cancer. So it probably is a risk factor for many illnesses, and one of them being cancer. But no, there's no direct relationship, but we can assume that it does play a role.
Apart from other types of cancer, I think breast cancer is coming out to become a major concern. Can you shed light on its symptoms and how it happens and what is its treatment?
Sure. So, breast cancer is probably, the number one cancer in women worldwide. Um, and overall, it is a success story in the sense that more people are living and are getting cured of the cancer if caught early. And even with more advanced disease, there's a lot of newer treatment options that are available so that people can live longer than they have ever before. I think the key would always be knowing the early signs and symptoms and knowing what to do next. I think if I could convey it, that's probably the biggest message that I would want to convey to the people out there, which is any woman who feels a lump, especially for women who've gone through menopause. If you're feeling a lump, that is abnormal, So typically they tend to be hard, not movable. And that's, and I'm giving you generalizations. That's not always the case, but hard fixed mass that's difficult to move. Any mass under the armpit, um, or any mass like above your, in your clavicle area, in the lymph nodes there, that is, a warning sign. And similarly, if a woman notices any redness over the skin of the breast, any nipple changes, any discharge, anything new that they've not noticed, those are kind of some of the symptoms. If somebody has more advanced breast cancer that they've, have not noticed, I would say things like if they're noticing new shortness of breath, and they have a breast lump, or they're noticing excruciating back pain. These are more, concerns for advanced disease. So the sooner someone feels a breast lump and gets to the doctor, the earlier we can do a mammogram, which is basically a fancy term for an x-ray of the breast. And we do a screening mammogram, and that basically looks at little densities in the breast and tries to, and the radiologist will then try to determine, does this, based on some criteria that they use, does this look cancerous, or does this look like a cyst, or something that's, like I mentioned before, non-malignant, something that looks more benign. Whatever it may be, we also follow it up with an ultrasound. And if something looks suspicious, they will go in and do a biopsy of that area. And they will also look at the armpit area where the lymph nodes drain. And if they see anything abnormal there, they will try to biopsy it. But I think the point I'm trying to make is that the earlier you catch the breast cancer, it is curable disease, which means if the lump is taken out, and sometimes some additional treatments may be needed, but these are the people that have a 90% plus survival rate for after 10 years, and they have long-term good prognosis. As time goes on, if a lump is growing, if it goes to the lymph nodes, if it starts spreading to other organs, that survival and overall prognosis, although it's better than it was, it's still not ideal. That survival rate will come down. So it's important to get the attention right away. And I know people are scared. Sometimes they'll feel the lump and they don't want to go to the doctor because of fear of being told it's cancer. But one should know that if it is cancer, it will continue to grow. And you're not really helping yourself. So it's better to, if you see a lump, you've never felt that before. And sometimes these lumps can come up really fast. I've had women who tell me, I've just had a mammogram 6 months ago and it was fine. And this lump came up within a month. So, these things can sometimes take time, or sometimes they can happen fast. But the important thing is to get the attention. When you talk about treatment, that is very much individualized. So we basically first stage the cancer. We see, what's the size of the lump? Are there lymph nodes involved? Are there any distant organs involved? And then it can, involve having a surgeon do some kind of a surgery to remove the lump, usually just to remove the lump. Sometimes may involve radiation, and sometimes may involve, pills or IV treatments. People who are in earlier stage may not need some of these treatments I'm mentioning. But the intention of all of this is cure. So that's the important part.
So, do you think cancer in general is it completely curable?
So, I mean, when we talk about the curability of a cancer, I like to look at certain factors. So, and this is sort of comes into prognosis. If someone says, well, what is my cancer curable? What are my prognosis? It depends, first of all, on what type of cancer it is, and where it is in your body, and the stage of the cancer. Is it localized? Is it early stage? Has it gone to other places? It also depends on your age. So the older you are, usually the person is more frail. They have more other medical problems. So that makes it a little bit more challenging. And how they respond to treatment. So um, the good thing now is that we no longer we're understanding more and more that the cancer, it depends more on the mutations that cancer has and the genetic profile. A lot of them, can make someone high risk versus low risk. It's not just, well, it's in one part of the body and it's spread, it's stage 4, and that means it's bad. It's no longer like that. So if you have the right mutations and we give you the right treatment for that mutation, people can have full responses. People can have remarkable responses to their cancer, even if it's all over your body. So understanding the biology of the tumor, knowing the mutations, knowing the genetic background, and kind of taking the patient as a whole, that kind of helps us, determine the curability of a cancer. But more and more cancers, if caught in the right stage, if they have the right type of treatment, people are living longer and having more, remission periods. Some cancers, we don't call it curable, but they can live for a long period of time without having it come back. So it's almost
Yeah.
like a chronic illness. So there's a lot of factors to call something curable or not.
And I mean, when it comes to treatment of cancer, what role clinical trials play?
So clinical trials are a very important part of, cancer treatment. Every treatment we suggest to patients is evidence based. So, and that's how it should be. Anywhere in the world, we have cancer centers that base evidence based rule, meaning that they're randomized trials that look at patients with similar characteristics that are enrolled. They've gotten treatment versus another patient who hasn't gotten that treatment, and that patient has done better on the treatment. So, with time, with hundreds of clinical trials, we get our guidelines. We know what's best to give each patient in what stage. We don't just arbitrarily come up with our own treatment plans. We follow the previous trials, we see the data and see what's best for the patient. So how do we get this data? From clinical trials. So there are ways basically to enroll patients and look at the newer treatment options and enroll and see if that newer treatment option will benefit the patient. So, we have clinical trials for drugs, we have clinical trials for vaccines. It helps us figure out the right dose of drug, for a patient, the type of side effects for patients. So there's, treatment trials, clinical trials. There are screening clinical trials. There are, palliative, treatment trials. So there's different type of clinical trials for the patients,
Yeah.
but it's our only way to get advances and get the newer treatment. So it's definitely something we recommend if the opportunity is available for the patient.
And along with clinical trials, what role does genetic testing play?
So genetic testing is really important. So what I like to say is, we all have we take family histories of, who has cancer in your family. And what genetic testing is, that about 5 to 10% of families will have a mutation that they're actually passing on to generations that predisposes them to cancer. So that's different than, sometimes there's the cancer that just happened to be in the family, but it's not because of a genetic mutation. It may be because they all have some risk factor that they share. So, for example, if someone's father has lung cancer because they smoked, and their grandfather had lung cancer because they also smoked, it's because of the smoking risk factor they have lung cancer, not necessarily because they have a genetic mutation. So, but about 5 to 10% of families do have this mutation. So what we typically do is we do a blood test, or a saliva test, and we send it out for sequencing and see, and there's a whole group of mutations it tests for to see, is there a gene that you have or someone in your family has that predisposes you to have cancer? Um, and some of the things that make us more aware that there may be a gene mutation is if someone has a lot of breast, ovarian, pancreatic cancers in the family, or a lot of colon, pancreas, certain cluster of cancers, if someone gives me a history.
Yeah.
And it's usually in first degree relatives. So my mom has it, my aunt has it, my grandmother on the same side has it. So it's not that father on one side and a grandmother on the other side. It's usually the same kind of linear maternal side or paternal side. Or if there's a family history of rare cancers, so everybody there's a bunch of rare cancers, those are kind of clues that there may be a genetic mutation going on. And it's important for two reasons. One is that, there are patients who are not even diagnosed with cancer, but if they get genetic testing and they do in fact have a mutation that predisposes them to having a certain type of cancer more, we would implement, certain screening protocols. For example, there's a BRCA mutation, which predisposes a woman sometimes 30 or 40 times more than a normal woman to get breast cancer. So if someone has that mutation, they get early mammograms, they get more screenings, just so that we can catch these things early. Um, and the other thing reason it becomes important is now we have drugs that we can give certain patients with certain mutations. So it's actually a treatment decision also when someone gets cancer. We have drugs that we give a second or third line, which becomes a valuable tool for our treatment. So, genetic testing certainly plays a role, not only to the patient, but also to family members. So if I have somebody who's diagnosed with, let's say, a mutation, we encourage, at least here in the United States, to have the family members also to come, children, siblings, so they can get the adequate screening done.
I totally agree with you on that. And do you think efficient cancer techniques or efficient cancer treatments are available in the world today?
I think, like I said, I think we are, again, this is very much dependent on the place. And this is where there's a huge topic about barriers of cancer care. Certainly in the bigger cities, I think, all the up-to-date treatments are available, but this is a challenge worldwide. How do we get the 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 right time to screening, the right time to getting the biopsy, the right time to get the diagnosis? Because we do know the earlier you screen and diagnose somebody, there have been studies to prove that you actually live longer if you get diagnosed and treated earlier. That's not always the case for a lot of cancers, but for a lot of them. For example, lung cancer. If you have a small lung mass, the earlier you can get a biopsy and you get that, mass taken out, the more you have a chance of survival and you live longer. So that barriers are there, I think worldwide, and some places more than the other. But there are various treatment options now. Earlier, what you always think about is chemotherapy. That's what the most people hear of. You get hooked to an IV, and people get it, and they lose their hair, and they have horrible side effects, and it kills every cell. And that's kind of a common, misconception, I would say. That's one of our treatment options. It's still a fundamental treatment option in many of the cancers. But now we have, like I said, targeted therapy. This is where we test each of the tumor to see what mutations it has in the right setting, especially in lung, for example, in lung cancer, breast cancer, and all the tumor types, I would say, wherever if it can be done, it should be done. Because if you have a target for which, if we have a drug for that, that's where they respond the best. So targeted therapy is one of the treatment options. You have something called immunotherapy, and that's really kind of revolutionized cancer care. And what that does is basically it allows your own immune system to fight the cancer. So it's an infusion treatment. Um,
Okay.
but, the cancers are very smart. What they do is they hide from your immune system. So you might wonder, I have a cold, my body tries to fight it. Why isn't my body trying to fight cancer? That's because, just simply speaking, it has mechanisms where it hides from our immune cells. So now we give drugs that kind of get rid of that block, and suddenly your immune system recognizes that there's these cancer cells growing and tries to fight it. So
Right.
we have seen remarkable responses with cancers we've never thought would be possible because of, immunotherapy. So for the right patient, it can have the remarkable responses. But again, everything is a challenge. Some people respond, some people don't. And so there's a lot of studies about why some people are responding and why other people are not. So,
No.
chemotherapy, immunotherapy, targeted therapy. For people with blood cancers, we have something called stem cell transplants. So that's an option, treatment option, something called CAR T therapy. There's sometimes we give heat therapy to patients, so there's various modalities. So with breast cancer, for example, a lot of patients are on oral pills, and they're called
Okay.
endocrine therapy, because majority of breast cancers are because of the female hormone estrogen and progesterone. They grow
Right.
because of the female hormones. So we give a blocker, we give an oral tablet that people can take for 5 to 10 years, that block that pathway so that the cancer cells don't grow again. So hormone therapy is one type of treatment. um, I'm talking about the medical treatments. You also have radiation, you have surgery, you have all those other things. So there's many different options available now, antibody therapy, to treat cancer.
So, what are the psychological impacts of a cancer diagnosis on patients, and what is the role of mental health support in it?
So I think that's a really good question, and I don't think it gets talked about enough. So there's a lot of psychosocial issues that we see when patients get diagnosed with cancer. It is a life-altering diagnosis, and unlike some of the other chronic illnesses, it does require a lot of monitoring, additional therapies. So I think we typically see the most intense psychosocial social impact probably different I would say periods of their cancer journey. So initially during the diagnosis, when they first get diagnosed and the biopsy, I think that's one point where there's a lot of anxiety and depression. During the treatment, at the time of scans. So there's this real risk of fear of recurrence, of any kind of milestone event can kind of trigger that cancer experience. There's also kind of this grief that I see that, my life will never be the same as it was. And
Yeah.
and I think, and especially, at least, I've been seeing more and more younger patients with cancer. So, I see quite a lot of people in their 30s with breast cancer, women in their 30s, and they're still having young children, or they're want to expand their family. So that kind of adds another layer for younger patients. But it's a basically a grief for loss of your health, your physical independence, your fertility, sexual drive. I think these are all kind of things we don't talk about, but as a result of some of the treatment side effects, depression, body image issues, and there's a lot of change in relationships. After the cancer diagnosis, we find that co-worker society, people in the family treat you differently. So there's a lot of that going on. And there's a lot of survivor's guilt. So sometimes I see, some people are living longer than others, and they kind of don't know why that's the case. And somebody who has also started their journey perhaps didn't have the same outcome as them. So there's a lot of impact to think about. And I think that's where I think more and more clinics are now doing distress screenings. They're giving questionnaires, or they have mental health counselors or social workers in clinics. And again, this is dependent on where you are in the world. I think they have different avenues or ways to do this, but basically to screen patients, are you feeling depressed? Are you feeling anxious? Kind of catching those people who may be silent and may not be able to express all their feelings, and getting the right kind of help. And that could be support groups, that could be talking to a counselor. Sometimes we may need to use medications if there's a lot of severe depression involved. um, you know and there's real side effects of the cancer therapies itself that can manifest as psychiatric problems. So people who are unable to sleep, after a while, if you can't sleep, it may be mistaken for depression and other things, but they all go hand in hand. So I think oftentimes as doctors, we don't have the time to always go into depth about mental health. We kind of say,
Mhm.
how's your
Yeah.
treatment going? What are the side effects? This is what your scan is showing. This is the next steps. But having a team unit in ideally in a cancer hospital with a social worker, a mental counselor, at least a support group who can screen and catch the people, because a large part of life, life moves on, life continues.
Yeah.
But we want people to live their life while having this disease. So finding that vulnerable patients and helping them is important.
I totally echo your thoughts. I mean, it's very important to, get the kind of mental help you need and the mental support you need to combat the aftermath of cancer.
Uh, and,
Uh,
and I do want to say one thing. I do think um, there is a lot of stigma with the cancer diagnosis, and it doesn't have to be that way. What I find funny is people have really bad, kidney disease that require dialysis, or people have uncontrolled diabetes. There's lots of health problems that people have, but and cancer, of course, I'm not saying that it's not something to take lightly, but it does require people, the society, to be supportive, and to know that getting the right screening, it should be a society goal, and and supporting people with cancer and knowing that they can live full lives, and having that society as a whole is extremely important.
yeah, I think that's totally the thing. I mean, getting the all of the support that you can get from your surroundings is very important.
Yeah.
And do you think there's any way to keep cancer at bay?
Yeah, so the many of the cancers are preventable based on the risk factors we had talked about earlier. So number one being, avoiding tobacco and tobacco-based products, avoiding secondhand smoking exposures. I think that's probably one of the biggest healthcare messages across the world is stop smoking. That can prevent a lot of cancers. Similarly, with limiting alcohol intake, like I saw a certain infection, so like HPV. So getting HPV screening done early, because getting that right treatment for that can prevent cervical cancer. And in some countries, they have vaccines to prevent HPV. Similarly with hepatitis B and C. So if you get diagnosed with hepatitis B and C, getting the right treatment, getting screenings afterwards to prevent, so infections, HIV can predispose you, AIDS can predispose you to certain type of cancer. So understanding that risk, and working with a doctor to do the right type of screenings is important. Another thing is maintaining a healthy weight. So obesity again is linked to a lot of cancer. So healthy body mass index, and eating a healthy diet, and diet is a big discussion on its own. That we can talk about for a long time. But the basic message is less processed foods. You know, we say eat the rainbow. So like lots of, healthy fruits and vegetables, and sort of less red meat, at least in, countries that do consume that. So a more healthier diet. And I think the biggest thing probably other than that would be screenings. So for some cancers that do have screenings, for example, screening mammogram for all women from age 40, I would say standard would be 50 to 75, but for certain women, if they have a lot of breast cancer in their family, you have to start that screening at age 40. At least once every 2 years, get a mammogram. Cervical cancer, again, a pap smear that can be done at the gynecology office. And they have ways to do certain testing every 2 years or every 5 years, depending on what screening method they use. Colon cancer, there's something called colonoscopy, which is basically like a camera that they use and
Okay.
look at your colon and see, are there any small polyps? Are there any, polyps that can grow into colon cancer? And that we usually tell them to start at age 50. Again, sooner, earlier, if there's a lot of family history of colon cancer. And if your colon, if it's not a comfortable procedure, but it's a very easy, tolerable procedure. But if there's no polyps or nothing, you don't have to get another one for at least another 5 to 10 years. But it's important to get that screening. So I think the big ones are the colon, breast, and cervical, I think, especially in India. Now, if somebody is a very heavy smoker, they smoked for more than 30 years, we do here CT scan, low dose CT of the chest to screen for lung cancer. And I think that's something that they're trying to implement everywhere in the world, and it has its own challenges. But anybody who's over 30 years of heavy smoking should get like a low dose CT scan just to see for any lung masses or nodules. So I think probably these are the big ones. So screening is an important part of prevention.
So I think both external and internal factors, they play an equally important role, in keeping cancer at bay. I
Yeah,
mean,
so
both of
we
them.
yeah, we don't know how much all these factors, kind of intersect with each other and why some people, like I mentioned, who have the risk but they don't get cancer, well, others do. So that's where probably the internal factors do play a role. Um, but whatever we can do to reduce that risk, that's what we try to encourage. But
Yeah,
you're right. We don't know how much of that they one plays a role over another. But certainly they both have a role.
role. And in addition to that, in fact, I think healthy lifestyle choices are also very
Right.
important to, I mean, keep it at
Absolutely.
bay.
Absolutely. Yeah.
Thank you so much, Shweta, for joining us. It was very good experience to know more about cancer. It'll
Yeah.
surely help our audience to understand the bits and pieces of it. Thank you so much.
You're welcome. I appreciate it. Thank you so much for having me.
And to our listeners, thank you for tuning in. We hope today's conversation has helped you understand better about cancer. For more of these episodes, don't forget to subscribe to BizzBuzz.